at this point. Typically there's a piece that will connect the catheter tubing to the suction, but we just don't have that right now, which is very unfortunate. So, okay. So I will undo this. We're going to reuse a lot of these supplies just because they're very easy to reuse. It's not like you lose a pair of sterile gloves every time or something crazy, which we will with the, hopefully, I hope that there's a pair of sterile gloves in that catheter tray, or the trach tray, I don't know. But if that's the case, because we're not working on an actual patient and I've already seen you use sterile technique, I'm not going to be as nitpicky with it because I know that you already know how to use it. So I'm actually going to need this anyway. So you will still need your suction for your trach here. So first thing is to increase supplemental oxygen prior to, we don't actually have them hooked up on oxygen, so you can either verbalize that you would or turn this knob. We don't actually have oxygen going through here, so as long as I see that you're adjusting the oxygen in some way, I'm good with it. Or you can verbalize that you would do it and not even worry about it, but it's not actually on. If the patient is on a ventilator or a trach dome, then just make sure that they're connected at all times. Most of the time, if you have oxygen going over, typically there's like the trach dome kind of goes right over top of the opening of the tracheostomy. You can just leave it. When we take it off, we would just sort of leave it right here so they're still getting a little bit of extra oxygen as you're doing the procedure. So you're not just totally taking it all the way off, but you kind of leave it there for them. It'll just sit on your chest. So raise the bed, place the patient in semi-Fowler's or Fowler's position. That's fine. Perform hand hygiene. Verify that the pressure suction source will not exceed 120. That's going to be over there, and that will just be verbalized again. The suction's not actually working. Open the suction kit and don said sterile gloves. So let's see what's in here. I'm actually going to move some of this. Okay. Okay, sweet. Here's some gloves in here. So I could maybe either get you some extra pairs of sterile gloves if you want to keep practicing sterile technique, or we can just use regular gloves. Again, I've already seen you do it, so I'm not that concerned. Verify, okay, right, open the suction kit, don your gloves. Or we can always refold the same. Gloves over and under. Okay. With both hands sterile, pick up the suction catheter and wrap. So this one's a little bit shorter than some of the others. I have this one here as well. Oh, maybe they're all that short. That's odd. For some reason, I feel like last year we were really wrapping around. Anyway, so yeah, about 40 centimeters, give or take. So we'll have different options for you. The idea, you just want to make sure that you have something that will occlude that section. So over here, it's this little horn-looking guy, and then on this green one, which is probably what you're going to end up with. I don't know how you would describe this. This little lift here. You can use that for your thumb as you're utilizing the section. So you open it up, pick up the suction catheter and wrap it around your dominant hand. So I am right-handed, so I'm going to wrap it around like so. With that non-dominant hand, I am then going to pour sterile saline into the basin. So that's what this doesn't have, is a basin. So what we'll do, and it doesn't actually even have any sterile saline, which is odd. We'll find some. But what you would do is if you have your sterile saline, then you would just, we're going to use this actual tray as the basin because it's still sterile. So you can just pour that in there, and that's going to be your basin, your sterile basin. So then with that non-dominant hand, then you're going to pick up a suction tubing and connect the two ends. So this hand right now is not sterile. It's this is going to be my sterile hand. This is my non-sterile hand. So I'm going to connect the two of these together. And then I've got the rest of my catheter here. So unwrap the suction catheter so the tip is in the dominant hand, the catheter's vent is in your non-dominant hand, so this will be where we use our occlusion. Dip the tip of the catheter into the basin. And then you want to test it. So you'll make sure that your suction's working, which unfortunately suction's not working, right? But we'll suspend reality and say that it is. So test the suction, and then holding the catheter between the dominant thumb and index finger, or however you want to. It doesn't matter which finger, but whatever you feel most comfortable with. But I do use my index finger. Then you're going to insert it through the tracheostomy until you meet resistance or until the patient coughs. Once you get there, for that 10 to 15 seconds, you're going to do suction intermittently. So it's just kind of in and out. And as you do that, you can twist the catheter and pull as you're twisting slowly out. Rotate and withdraw the catheter. And then you'll rinse the catheter with the normal saline and repeat. So when you're going in, you're going to advance. Again, I don't think that you're going to get that far with this. Oh, all right, okay. So go as far as you can get until you meet resistance. And then as you're pulling out, you're going to rotate and intermittently apply suction as you're withdrawing the catheter. And then it will come out, and then you will rinse again, get all that gunk out of there with that sterile saline, and then however many times you need to do it. You're only going to need to do it once for your test out. Cool. I think that's it. Any questions on that? I know, but these are pretty straightforward and easy, and getting to do it in a team really helps. So, some of your kits, like this one, the suctioning was open. Other kits, like the kit that we had last quarter, which is not here today, but it kind of came in its own separate little baggie. I think that this is what we're going to end up with, where it's